Carbamazepine is an anticonvulsant used to treat various types of seizures and pain resulting from trigeminal neuralgia. In this video, let's found. What is carbamazepine? What is carbamazepine used for? Contraindication. What are the side effects of taking carbamazepine? How does carbamazepine work? How to use carbamazepine? What is carbamazepine? Carbamazepine, sold under the brand name Tegretol among others, is an anticonvulsant medication used in the treatment of epilepsy and neuropathic pain. It is used as an adjunctive treatment in schizophrenia along with other medications and as a second-line agent in bipolar disorder. Carbamazepine was discovered in 1953 by Swiss chemist Walter Schindler. It is on the World Health Organization's list of essential medicines. In 2020, it was the 185th most commonly prescribed medication in the United States, with more than 2 million prescriptions. What is carbamazepine used for? Carbamazepine is indicated for the treatment of epilepsy and pain associated with true trigeminal neuralgia. In particular, carbamazepine has shown efficacy in treating mixed seizures, partial seizures with complex symptoms, and generalized tonic-clonic seizures. Carbamazepine is also indicated for the treatment of manic episodes and mixed manic-depressive episodes caused by bipolar I disorder. Some off-label, unapproved uses of carbamazepine include the treatment of alcohol withdrawal syndrome and restless leg syndrome. Contraindication. Carbamazepine is contraindicated in patients with bone marrow depression and hypersensitivity to this drug or tricyclic compounds such as amitriptyline. Before administration, monoamine oxidase inhibitors should be discontinued for a minimum of 14 days. Side effects: dizziness, drowsiness, thinking abnormal, difficulty speaking, uncontrollable shaking of a part of the body, constipation, dry mouth, problems with walking and coordination. Pharmacodynamic. General effects. Carbamazepine treats seizures and the symptoms of trigeminal neuralgia by inhibiting sodium channels. In bipolar I disorder, carbamazepine has been found to decrease mania symptoms in a clinically significant manner according to the Young Mania Rating Scale, RS. Carbamazepine has a narrow therapeutic index. A note on genetic variation and carbamazepine use. In studies of Han Chinese ancestry patients, a pronounced association between the HLA-B*1502 genotype and Stevens-Johnson syndrome and/or toxic epidermolysis, SJS/10, resulting from carbamazepine use was observed. Mechanism of action. Carbamazepine's mechanism of action is not fully elucidated and is widely debated. One major hypothesis is that carbamazepine inhibits sodium channel firing, treating seizure activity. Animal research studies have demonstrated that carbamazepine exerts its effects by polysynaptic nerve response and inhibiting post-tetanic potentiation. In both cats and rats, carbamazepine was shown to decrease pain caused by infraorbital nerve stimulation. A decrease in the action potential in the nucleus ventralis of the thalamus in the brain and inhibition of the lingual mandibular reflex were observed in studies after carbamazepine use. Carbamazepine causes the above effects by binding to voltage-dependent sodium channels and preventing action potentials, which normally lead to stimulatory effects on nerves. In bipolar disorder, carbamazepine is thought to increase dopamine turnover and increase GABA transmission, treating manic and depressive symptoms. Half-life. The mean elimination half-life of carbamazepine was 35 to 40 hours after one dose of carbamazepine extended-release formulations. The half-life ranged from 12 to 17 hours after several doses of carbamazepine. Dose. Epilepsy. Indicated for the treatment of partial seizures with complex symptomatology, e.g., psychomotor, temporal lobe, generalized tonic-clonic seizures, grand mal, and mixed seizure patterns, which include the seizure types listed here or other partial or generalized seizures. Maintenance dose range, 800-1200 mg/day PO in divided doses. Therapeutic range, 4 to 12 mg/L, 16.9 to 50.8 micromoles/L. Maximum dose of 1,600 mg per day recommended. Rarely, some patients have required 1.6 to 2.4 g/day. Tablet, immediate release. Initial, 200 mg, POQ12HR. Increase Q week, by 200 mg per day, divided POQ6-8HR tablet/capsule, extended release. Initial, 200 mg, POQ12HR. Increase Q week, by 200 mg per day, PO divided Q12HR. Oral suspension. Initial, 10 ml, 200 mg, POQ6HR. Increase Q by up to 200 mg per day, PO divided Q6-8HR, for solution. Indicated as replacement therapy in adults for PO carbamazepine formulations, when PO administration is temporarily not feasible. Approved as temporary use, i.e., less than or equal to 7, for the following seizure types. Partial seizures with complex symptomatology. Generalized tonic-clonic seizures. Mixed seizure patterns, which include the above, or other partial or generalized seizures. Dose. The total daily dose of carbamazepine 4 is 70% of the daily PO dose from which patients are being. Equally divide the total daily dose of the 4 and 4 30-minute infusions, separated by 6 hours. Patients should be switched back to oral carbamazepine administration at their previous total daily oral dose and frequency of administration as soon as clinically appropriate. Administration has not been studies for greater than 7 days. Limitations of use. Not indicated for absence seizures, including atypical absence. Carbamazepine has been associated with increased frequency of generalized convulsions in these patients. Trigeminal neuralgia. Indicated for associated with trigeminal neuralgia, beneficial results have also been reported in glossopharyngeal neuralgia. Carbamazepine is not a simple analgesic and should not be used for the relief of trivial aches or pains. Maintenance dose range, 400 to 800 mg/day PO in divided doses. Attempts to reduce or discontinue the drug should be made at least every 3 months throughout the treatment period. Maximum dose of 1,200 mg per day recommended. Tablet, immediate release. Initial, 200 mg per day on day 1, divided Q12HR. Increase by 200 mg per day in increments of 100 mg Q12HR. To dose range of 400 to 800 mg/day, divided twice daily, not to exceed 1,200 mg per day. Tablet/capsule, extended release. Initial, XR tablet 200 grams per day PO on day 1, divided Q12HR. Initial, XR capsules 200 mg PO once on the first day. May increase dose by up to 200 mg per day using increments of 100 mg Q12HR to reach an effective/tolerated dose, not to exceed 1,200 mg per day. Increase by up to 200 mg per day in increments of 100 mg Q12HR, to dose range of 400 to 800 mg/day, divided twice daily, not to exceed 1,200 mg per day. Oral suspension. Initial, 200 mg PO on day 1, divided Q6HR. Increase by up to 200 mg per day in increments of 50 mg Q6HR, to dose range of 400 to 800 mg/day, divided twice daily, not to exceed 1,200 mg per day. Bipolar mania. Equetro. Indicated for treatment of patients with acute manic or mixed episodes associated with bipolar I disorder. Initial, 200 mg POQ12HR. Increase by increments of 200 mg per day, not to exceed 1,600 mg per day. Safety advice. U.S. FDA Pregnancy Category D. There is positive evidence of human fetal risk based on adverse reaction data from investigational or marketing experience or studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. That's all the information about carbamazepine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.